Happy Tuesday. Time for Tidbit Tuesday. So this week, I thought a good piece to talk about would be the different kinds of coverages your policy may have and when to use those coverages. So a lot of policies have teledoc options or televisit options. And so that is your first line of defense. That's going to be your least costly option if you need medical care. Always encourage people to make sure if you have teledoc or telehealth, you have that all set up so when you do need it, you can call and use it. That's your first line of defense. Your second line of defense is your primary care doctor. So primary care doctors, you go in, you may have a copay for that visit. If you're sick, you still may have a copay for that visit. That's your next line of defense and the least expensive than the next two choices. Next, urgent care. Urgent care can do many of the things that ERs can do. If you're having a heart attack, you need to go to the ER. Urgent cares can take care of broken bones, stitches, respiratory issues. If it's after hours or on the weekend and your primary care is not available, you don't have telehealth, then urgent care is your next best bet. And depending where you go, I always encourage all my clients is to find out who's in network, make a list from your plan, who's in network closest to you as far as your urgent care and your ER. Because when you do have an emergency or an urgent situation, you don't want to have to worry about finding a network doctor. You already want to know where you need to go. So urgent care is way less expensive than ER. And so I always recommend you go there next. In a lot of plans, you don't have to meet a deductible before it'll pay. There's a copay for urgent care. So lastly, your last choice is ER. I tell all my clients you really should reserve ER for dire situations. If you're not feeling well, you have a stomach bug, do not go to the ER. You're going to get charged thousands and thousands of dollars at the ER that you're probably going to be on the hook for because you may have a big deductible you have to meet. And so a lot of the plans, ER visits are not covered till you hit your deductible. So if your deductible is $5,000, $8,000, that means you're going to get a bill from the ER for those things. And ER is overinflated prices to begin with. So not only are you stuck with a bill, is they're quadrupling charging you what the normal fee should be for something like that. And urgent care does a fraction of the cost. So I tell people, please don't use the ER unless you have no other choice, because that can be super expensive. So what to do if you do have to go to the ER? Okay, well, sometimes it might be best just to tell them you're a cash pay patient. I kid you not. If you don't present an insurance card and you tell them you're cash pay, yes, you may initially get a bill, but then you can call and ask for a cash discount. Because I promise you, if you have a deductible that's $5,000, $8,000 or more $1,000, you're going to owe that. And if you say you're a cash patient, there's one hospital in particular that I know will give you an 89% discount if you're cash pay. So if they charge you, to do round math in my head, $10,000, and they take off 89% discount, you're looking at a bill of around $1,000, $1,100, which is way better than $5,000 or $8,000. So knowing where to go, I can tell you if you want to know the name of the facility, I'll tell you the best place to go for negotiating and for cash price discount. My husband knows to take me there. That's something that's urgent for me. But do not use the ER unless you absolutely have to. ERs were always meant for dire circumstances, and unfortunately, people who don't have health insurance feel like they can't go to the doctor, and so a lot of people use the ER just for regular visits. Not only does that tie up the ER when there's more urgent things that come in, big expensive bills, a lot of times the hospital will write off. And again, you know, that comes back to the cost of things. And it actually figures into your taxes as well, because if you notice on your property taxes, there's hospital in a lot of places. And that's figured based on different things. But having to write off a whole bunch of stuff is one of them. So hop on over to my page, JCAP Consulting. You can always schedule a time to talk with me. Check out your plan, make a list and put it on your fridge of who's in network close to you, urgent care and ER. And something to remember that I forgot to mention about urgent care is make sure when they bill as urgent care. There's a little trick that some of these places use, that if it's after hours, they charge the same rate as an ER. So that's good information to know as well, so that you're not, again, stuck with a super big bill. So hope to see you on my website. And until next week, peace out.